Hey everybody, this is Dr. Vince from FTR in Joliet, your local physical therapist. Today I'm going to demonstrate what's called the TUG test. It has nothing to do with boats. It's all about how fast you can get up from a chair, walk 3 meters. I know we're in America. It's about 10 feet, okay, for those of you that can't do the conversions. It's about 10 feet, walk out to that point, turn around and come back and put your bottom in the chair. The test starts from the time that your bottom leaves the chair, that you start initiating the movement, to the time that your bottom touches the chair again. I'm going to demonstrate for you. You can use your hands. You're going to stand up, walk that 10 feet, turn around, come back, and have a seat. What the research shows is that older adults that do this in greater than 12 seconds are at an increased risk for falling. Medicare used to define this as 8.5 seconds. So if it took you longer than 8.5 seconds to do this, you were at an increased risk for falling. What we're looking at here is, one, what is your leg strength? How well can you get out of a chair? Okay? If you're having a lot of trouble getting out of a chair, it's going to greatly increase the amount of time it takes you to do this test. The other thing that we look at is, what's your short distance walking speed? Okay? If you have to use a walker or a cane, it's going to take you time to set up and then actually take off. If you're a slow walker, this test is going to take a long period of time. If you're a fast walker, the next thing that we're going to look at is how quickly can you change directions. So when you get to that 3 meters, or 10 feet for those of us in America, how fast can you turn around and then turn around again? Again, those patients that have walkers, it's going to take them a while. And I've seen this test take up to 2 minutes for some patients who had trouble negotiating the walker in one direction and another. Okay? These patients who have trouble negotiating the walker, I become concerned about. Because if they're at home alone and they have to make these turns, they are at an increased risk for falling. So again, the TUG test, not related to the tugboat, the TUG test is a test that we can use in the clinic to determine if a patient is a fall risk. Thanks for watching.